So basically, one of the issues is you had to be on steroids because you had a flare-up of ulcerative colitis, and with the wound itself, the treatment is steroids. So you needed to be on that to control the inflammation type side of things. The problem is you also had some level of perforation somewhere, which caused the bacteria to form an abscess. And the problem with an abscess is when you're on steroids, it makes it harder for the body to fight the infectious process. So you're on the antibiotics, which is fighting the infectious process, but you had that perfect storm of needing to be on a immune suppressant to some degree with the steroids and needing to be on an immune booster, so to speak, with the antibiotics. And the problem is when both of those are going on at the same time, it makes a harder picture to deal with because you need to treat both conditions.
Right.
However, if you didn't have the ulcerative colitis, you hit you with hard antibiotics, your body ready and drain it, that's it. You see what I'm saying? If you didn't have the abscess, you hit it with hard steroids, you're done. Problem is you have both going on, and so it really creates a complex situation.
So if I came in with just the wound on my leg, and no indication that I was in a flare whatsoever, would the number of antibiotics that I took once I got here, would that have exacerbated my colitis?
I would not expect that to have antibiotics to cause
What
that.
about Toradol? Because for a few days I kept saying I can't take anti-inflammatories, I can't. And it got to the point where Dr. Hawkins was like, you know what, you're in the hospital, you can try it, see if it helps. I tried it, it relieved so much pain.
Yeah.
But then a couple days later, all this happened. So could the Toradol have attributed to that?
I would not expect Toradol to have done that.
Okay.
Yeah, I wouldn't. Yeah, and the thing is, your wound, the type of wound it is, with the pyoderma gangrenosum, its treatment is steroids.
Yeah.
Even without the ulcerative colitis.
True.
You see what I mean?
Yes.
So it's not like that. They're connected with that treatment. If you came in with ulcerative colitis and the wound, and that's it, and there's no infectious process, boom, done. You see what I mean?
So the whole thing with my appendix just kind of...
That throws a wrench into everything.
Got it.
And so now you're treating two conditions that are treated very differently, but you have to be treated with both of them. And so we're seeing improvement, just not as quickly as we would hope is kind of where we're at.
Do you have any thoughts on my heart rate?
Heart rate. I personally don't. I know they're working on that. I personally, I'm just, like I said, I'm rounding on the patients this afternoon. I don't have any insight one or the other at this point.
Okay.
If I do, I'll let you know.
Okay.
But I know they're kind of following along and making sure everything's safe. You did an EKG, thankfully showed nothing but
I know, that was,
heart rate.
The EKG was the first time that my heart rate has been like around 100. And not like, Yeah. So, I mean, I don't feel any symptoms that accompany tachycardia and whatnot. And just kind of chalk that up to my pain level, I guess.
And that very well could be.
And steroids.
Steroids, pain level. What we want to make sure, and that was another big concern, because when there's an infectious process and a heart rate starts going up, it can mean the infectious process has gotten worse.
Oh.
And that's why, we got to watch. And that's why they really got on the ball with that this past weekend to say, okay, what is going on? And thankfully, it's been pretty stable.
Yes.
And it doesn't seem to be related to that. So that's a good thing.
This heart, I just walked down the hall a few minutes ago. And right here became rock solid and painful just around the drain site.
Okay. I'm not, feeling anything like
That's where it was.
Induration or anything on the skin that would
Okay.
be concerned for like an underlying skin infection or anything like that. I'm not
Okay.
feeling anything like that, which is good.
Okay.
Oh, alrighty.
Thoughts?
Well,
Days?
at this
Prognosis?
point, that I just got it.
Should I change my shipping address on Amazon?
Yeah, anyhow. I'm glad we got the new valve on. Dr. Lionel is now here as well, and Dr. Hawkins, and I know they're putting their heads together and keeping an eye on things. And I love that the white blood cell count is coming down.
Yes.
I wish it was down. Does that make sense? But
yes, it does.
Down. And exactly what Dr. Lionel did this morning, I think, was what you needed.
It was
just
so
really
much.
good, aggressive, saline, infusion of saline, and just kind of get out of the junk and that type of thing.
I get it's just. I mean, ask Carrie.
Yeah,
I was miserable, but it has to happen,
Yeah.
I actually got a phone call from your office while you were talking to remind me of my appointment.
Yeah. When is your appointment?
I don't know. I'll have to call.
For a while.
I'll have to listen to voicemail.
I think I set you up.
Thursday?
Preemptively Thursday.
I think it is. I think that sounds right.
So we can, I can give him a call when we leave here. And I'll tell him, let's just hold off on that. Because Lionel's here. That was under the thought. This is back. I think I made that back before you started having like the right lower quadrant pain and that type of stuff.
Yes. Yep.
Yeah. So I'll go ahead and get that canceled. So
thanks.
you're not worried about it. Okay.
Appreciate it.
All right. You have an uneventful night. Okay?
I'm so glad that you were here.
Yeah,
thanks for stopping by and thank you for
Emily-
everything.
Emily will be here the rest of the week.
Okay.
She'll be checking on you in the afternoons.
Okay,
And if anything
perfect.
changes, she'll be able to let you know. Okay?
Thank you, doctor.
Yep.